I'm presenting a case of an adenocarcinoma of the lower right lobe of the lung in an 81 years old male patient who has a history of smoking and reported shortness of breath. Based on the microscopic description, we were able to confirm the presence of the malignancy. And what I would like to do today is to show you the classic features of an adenocarcinoma and how can you make the diagnosis right on the spot based on morphology and cytology. Of course, you would hear someone who would say, don't push cytology, and I do respect their opinion and I agree. On the other hand, you would hear some experts from the San Francisco Hospital General who disagree and tell you that medicine is in trouble because we're a later national immunostate, and I also respect that as well. Today, in this case, I'm going to show that both are correct, and I'm going to show you what kind of steps have we done in this case to confirm malignancy and the type as well. Here, if you look at the smear on this side, the very first thing and the most striking feature of an adenocarcinoma is what we call the nuclear cytoplasmic polarity. The nuclear here is being, if you notice, it's being pushed to the side of the cytoplasm. It's almost like going toward the periphery of the cell. This one is a very classic feature of an adenocarcinoma. The other feature we look at the nucleoli. You can have more than one nucleoli within the nuclear, and also the sizing. The nucleoli size increase in relation to the staging of the tumor. The other feature here is the balling, the way those cells are arranged in relation to each other. It almost looks like you're having a ball here. The cells are forming a ball, where you're having the nuclear is having variable shapes, the variable sizes, and there's loss of polarity where they're all over. They don't have specific direction. So this is very common and striking features of an adenocarcinoma. And of course, when we're talking about, you might be hearing terms of rosette, acini, ball. This all refer to the formation and how those cells form, like the gland formation, as we see in this case. Um, going back to the first slide, look at the cytoplasm. This is another feature you should look into. The cytoplasm in adeno usually would be delicate. It might have vacuoles. You wouldn't see it as dense. You might even see some mucin inside. Looks like a bubble where you're having like fluid in it. That's called mucin. So it's not unusual for you to see those type of features. And of course, we're not going to get into talking about the different types of adeno because you can have an acne adeno, you can have what we call mucinous. So we're just talking about the general feature based on cytology and morphology of those malignancy or those malignant cells. We have done thoracentesis on the same patient, and unfortunately, it turned out that the patient was suffering from stage 4. The cancer already started spreading outside the lungs. How does staging take place? You have to consider two things in terms of staging lung cancer. One, what is the size of the tumor? Two, is the tumor localized to an area or is it spreading? In stage 1, if you're having a tumor cell less than 5 centimeter and it's only localized to one area, that's considered to be stage 1, and it can be very easily treated with two options. One, the surgical resection or chemotherapy. In stage 2, the malignancy cell will be bigger than 5 centimeter, and they would be moving on to the nearby lymph nodes. Stage number 3 is when you're having those cancer cell moving around the lung and the lungs actually. Stage 4 is when you're having malignancy outside the lungs into the bloodstreams, other organs, and fluid. Treatment. How do a cancer patient or lung cancer patient get treatment? Two factors as well. You have to look at the staging and also the gene mutation. Each patient will get a biopsy from the cancer cell, and they will determine based on the gene of those cancer cells as what type of treatment you will get. Of course, what I would like to leave you with today is a word of advice. Keep your routine visits to your physician. Um, Check for any abnormal signs and symptoms of your body. For example, especially for smoker. For example, uncontrolled cough, a shortness of breath, pressure in the chest area, difficulty breathing when you're laying down at night, pressure in the chest area, loss of weight, loss of appetite, unexplained fatigue. Any of these signs, make sure to check out as soon as you find out. If you see or if you notice any abnormal swelling in the lymph nodes, make sure to report it right away to your physician to get a treatment. Timing is very essential in lung cancer patients. Of course, to keep everyone happy, we did immunostain. We did the TTF1 and NAPSIN-A. Both of those Asian were positive, strongly positive, which suggests that the adenocarcinoma did originate from the lung as primary. Um, I'm going to leave you with this sum of information. If you have any comments, please leave it in the comment area. I still have more interesting cases to share with you. Keep your hopes up. There are studies being done on in terms of immunology, gene therapy as well. Keep your hopes up, and we're hoping you will be having more treatment options for those patients who suffer from lung cancer. Thank you for your time and looking forward to share more cases in the near future. Thank you and have a wonderful day.